So next one is the skull fracture. So what are the different type of the skull fractures? So here we have to understand, depends upon the appearance of the skull fracture. So it is called as, the name we can call as the linear fracture, depressed fractures, diastatic fractures, and basilar fractures. Linear fracture means here is going to be like a linear, like a line, one line structure is going to get the fracture. Depressed means if any hit directly, the part is going to be go inside, becomes the shallow. And also diastase fractures is mainly affected the suture area, especially in the infants. And also basilar fracture is going to be the base of the skull is going to be affected. So we are going to discuss what type of all the type of skull fractures here. The first one is the linear fracture. So this linear fracture, so break in the continuity of the bone. So that means if you see here, the linear fracture, we are going to see only lacerate, like we are going to see the one line in the fracture in the skull. So it appears in the thin lines on the X-rays. So if you see here, so it's going to be like a one line we can see here, or maybe we can see is the fracture. The line is going to, we can observe here. So these are going to be the linear fracture. So full thickness through the bone. So it's going to get the, we can find the, how much the thickness we can find in the X-ray. The half little significance except when it runs thorough. So sometimes it's difficult to find the linear fractures, but this type of conditions, if it's not severe symptoms, so we can like a management will be just wait and see the management. That means if no complications, we have to wait and see, it's automatically it's going to heal. But in case of other complications, vascular channels, venous sinus grooves, and sutures. So we have, sometimes we cannot find anywhere the fractures. In those conditions, we have to check any vascular channel problem or venous sinus groove or suture areas we have to observe thoroughly. Then we can easily find out where is the fracture in the linear fracture. And also next one is the depressed skull fracture. So depression skull fracture is going to be depression. So that means if it is a fracture, if the force is happened to the at one particular side, so the both sides are going to get the fracture. So this is going to go is away from the continuity to the from the skull bone. So the broken piece of the skull bone is pressed towards the or embedded in the brain. So it's going to towards the brain after the fracture. So here the neurological deficits are going to be happening and also may chance to get the dural tear. So the dura mater is going to get the injury. So it gets is hematoma and also infection in case of the depressed skull fractures. So here you can see the depression. So it's because of the pressure, bone fragments are going to close to the brain. So that is called as the depressive fractures. And also the another fracture is called as the diastatic fractures. So the fractures are going to be happen at the suturing areas. We can see the coronal sutures and also frontal sutures and also occipital sutures. So here is, so if any the separations in between the sutures, so it is called as the diastatic fractures. So this most commonly seen in case of the infants if anybody get injury. So these diastatic fractures, suture lines are traumatic suture separations. So the sutures are going to be separated, most commonly affected newborns and also infants. So because of in those like infants and also newborn babies, these sutures are not fused completely. So they may chance to get these suture separations. And also most common location is a lambdoid and also sagittal suture. So here this part is going to be the lambdoid and also here is going to be in the sagittal suture is going to be affected. So it's a more than two separation is that is the asymmetry. So it's going to be, if when we are going to call, if it is more than 2 mm of the suture separation, it is called as the diastatic fracture. So this is the different type of the fractures. So this is the, and also next one is the basilar fracture. If you see the basilar fractures, so 3 types of the basilar fractures, we can see the base of the skull. So here is going to be the anterior cranial fossa, anterior one, and also middle cranial fossa. This if you fracture, if anything fracture in the middle is called as the middle cranial fossa fractures, and also posterior cranial fossa. So if any fracture in these sides, so it depends upon the involvement of the fossa, the cranial fossa. So we called as the name itself we called as anterior or middle or posterior.